Surgeons are lying to you. Most surgeons who perform LASIK eye surgery will tell you it is as routine as brushing your teeth. In a survey, surgeons boasted a customer satisfaction rate of 90% to 95%, but the truth is they were lying. Let's meet Robin Kyle Reeves, who lives in Florida. Robin wishes her LASIK story was just a bad dream. For Robin, what was supposed to be a simple, life-improving surgery turned her life into a nightmare. Now she is living in a world where even the simplest tasks have become her biggest challenges. So what the heck went wrong? Let's find out. Before we tell you Robin's horrifying story, do you know what LASIK actually is? Well, it's a surgical procedure that is intended to correct vision by reshaping the cornea, which is the clear front part of the eye. Surgeons do so using a laser. This should ideally reduce or eliminate the need for glasses or contacts. The process sounds futuristic. They use a laser to cut a tiny flap in the cornea, and then another laser to reshape the cornea underneath, and the flap is laid back in place. It is quick and straightforward, or so it is often described. Now, let us tell you what happened with Robin. Robin Kyle Reeves is a resident of Laurel Hill, Florida. She was once deeply involved in her passion for creating delicate lace gowns for children's baptisms and portraits. We don't need to tell you that both of these jobs require sharp eyesight. You probably already know that. Unfortunately, her eyesight was weak and she had to wear glasses all the time. But then, her doctor pitched her to get LASIK. Her doctor pitched this procedure to her as quick and simple solution to her visual hurdles. He promised her that this procedure would take less than 30 minutes, and after 30 painless minutes, she would get a life free from glasses. It seemed like a great idea at that point, so she agreed to get LASIK done. However, the reality post-surgery was far from what Robin had thought in her wildest dreams. Rather than the clear vision she was promised, she suffered from severe complications right from the start. The surgery left debris under her corneal flap, which led to double vision. This was a debilitating error that made her precise work with lace impossible. She was heartbroken the moment she felt like she'd never be able to lace gowns anymore. Her ability to sew was a source of income and joy for her, but that all vanished overnight. She found herself unable to focus on the detailed stitches that were required for her craft. Financially, it was a disaster too. Robin had to cancel orders and refund deposits, which was a direct hit to her livelihood. We know that LASIK is widely performed, and surgeons often brag about how high satisfaction rates are, but now we also know that Robin's experience is quite the opposite from what surgeons made it sound like. Robin's case proved that what is routine for one person can be life-changing for another. Statistics often mention a satisfaction rate of 90 to 95%, but what about the 5 to 10%? Their stories, like Robin's, reveal the complexities and risks that can sometimes be downplayed. Experts have begun to reevaluate the procedure. Did you know it was Dr. Morris Waxler, a former FDA advisor, who initially supported LASIK? But did you also know that now he says he regrets giving approval to this horrible procedure? He points to data suggesting that complication rates are significantly higher than the public is led to believe. Sometimes they affect up to 30% of patients. This is too high of a figure to be ignored. Robin's difficulties with vision are not unique in the world of post-LASIK patients. Most report long-term effects like glare, halos, and starbursts when looking at lights, which can be particularly distressing at night. These are not any minor annoyances. They can severely impact someone's ability to drive or move safely in low-light conditions. Robin isn't even suffering alone. We have encountered uncountable online forums and support groups where thousands have talked about how they face similar post-surgical problems. These communities are important for support and advocacy, showing that the problem is more widespread than some might assume. The FDA has recognized the risks associated with LASIK and is currently revising its guidelines. This means they plan to highlight the possibility of serious side effects more clearly than before. Their goal is to ensure that doctors fully inform potential patients about these risks before proceeding. This change could lead to more thorough discussions between surgeons and those considering the procedure. It will ensure that patients have a better understanding of the potential complications before getting the surgery so that they can make an informed decision. So, what are the things patients will be hearing from their surgeons? Well, the FDA will force doctors to mention all the complications. For example, talking about permanent changes like never really recovering from dry eyes or chronic pain. Plus, sometimes people also suffer from depression or thoughts of suicide. Technically, we have not linked these complications to the procedure, but the FDA is still figuring out if LASIK is the actual villain here. Either way, it looks like they want to make sure patients know what they're getting into. Take Paula Kofer from Tampa, for example. She paid up hoping LASIK would let her lose her glasses. Instead, she got night vision so bad that she now needs 4 different pairs of glasses just to manage. Paula got so riled up she started a Facebook group and now has over 8,000 members who share their own horror stories about life after LASIK. Then, there's the case of Gloria McConnell from Florida. She thought a second LASIK surgery might fix her farsightedness, but instead, the procedure left her with unbearable pain, and most days, she could not even get out of bed. Sadly, she felt so overwhelmed by her suffering that she decided to end her life. Her family says she was completely different before the surgery, full of life and laughter. Cynthia McKay is a retired clinical professor of ophthalmology at Columbia University Medical School. She passed some shocking remarks about this type of surgery. In fact, she even feels that she has seen enough to call for a total ban on the surgery. According to her, cutting into the cornea messes with nerves that are important for keeping your eyes healthy and pain-free. She also has seen too many cases where patients are handed consent forms moments before surgery, which is hardly the right time for making informed decisions. Even experts like Morris Waxler, who used to work for the FDA, are saying the current warnings about LASIK are way too soft. He believes if people knew all the potential risks, very few would choose to go through with it. That is a bold statement, but it comes from seeing the aftermath when surgeries don't go as planned. LASIK surgery is often touted by ophthalmologists as a safe and effective way to ditch your glasses for good. They point to studies showing high satisfaction rates among patients, with only 1.2% of people expressing any regret. But let's not gloss over the fact that these studies might have a hint of bias. After all, they are often conducted by the same doctors who perform these surgeries. Dr. Sidney Gicheru is the medical director of Laser Care Eye Center in Dallas, and someone who has had LASIK himself. He often speaks about the procedure in glowing terms. He remembers his own LASIK surgery as one of the best personal decisions he has made. According to him, most people who go through with LASIK end up really happy with the results, enjoying the simplicity of life without glasses or contact lenses. But the thing is, even though Dr. Gicheru and many of his peers paint a pretty picture, the reality is not always so clear-cut. The truth is not everyone is a good candidate for LASIK, and the surgery is not without risks. Dr. Gicheru himself outlined some key criteria for potential candidates. He said that first of all, you have to be over 18 to get the surgery. After that, you have to have a stable eye prescription for at least a year. And the most important thing is that you should not be suffering from severe eye issues like chronic dry eyes or major corneal diseases. Do you know why? Because LASIK involves reshaping the cornea. If the cornea is already compromised, the surgery could exacerbate these conditions, which could lead to discomfort or further vision problems. People with uncontrolled diabetes or significant astigmatism might want to think twice or consider alternative treatments. Diabetes can affect wound healing, potentially leading to suboptimal recovery, while significant astigmatism can complicate the reshaping process of the cornea, possibly resulting in unsatisfactory vision correction. This is why, in these cases, alternative treatments might provide a safer, more effective solution. Now, let's circle back to Robin Kyle Reeves' situation, whose LASIK experience was far from what she had hoped for. Post-surgery, Robin found herself struggling with severe complications that drastically altered her daily life. She cannot drive anymore and relies on family for simple errands far from the independence LASIK was supposed to offer. After her extremely bad experience, Robin returned to her clinic to talk to her doctor. She was desperate for solutions at that time. But imagine her shock when her doctor suggested another Lasik procedure. He said it could maybe solve her complications, or not. Robin was understandably skeptical about this course of action. Can we blame her? One surgery had already ruined her life. How could she bet on another one? The lesson that we learned here is that Lasik can absolutely be a game changer for your life. It could be for better or for worse. While many patients do enjoy the benefits of clearer vision without the hassle of corrective lenses, there is a big minority whose lives are turned upside down by complications. If you're thinking about Lasik, you need to look beyond the brochures and the hype. Talk to real people who have gone through it, get the full picture of what could go wrong, and seriously think about whether it's worth the risk. In the end, Lasik is not just another routine procedure. It is a big decision that could have lifelong implications. So take your time, do your homework, and make sure you're making the best choice for your health and happiness, because once you go ahead with it, there is no turning back. Would you ever get Lasik if you had to? Let us know in the comments below. Before you go, make sure to like this video and subscribe to our channel for more eye-opening stories like this. Thanks for watching, catch you next time.